Hi, I'm Jim Thomas. I'm here with Amanda, and we're going to be talking about what's happening out there in the world of addiction and recovery in the face of this COVID crisis. I'm a licensed marriage and family therapist, and I train therapists in emotionally focused couples therapy and family therapy. And I know Amanda through this work. I was just sitting, I work in addictions and trauma and mental, emotional issues that people struggle with that could be intensified absolutely by the COVID crisis. And I was just wondering about like what's really happening out there in the treatment world in the face of this. And when I thought, who could I talk to about it? Immediately I thought of Amanda. Amanda is a clinical consultant to families seeking treatment throughout the United States and Canada. And she does something really rather remarkable. In a wonderful combination of head and heart, Amanda can help a family and a person of concern to slow down when they're making one of the most important decisions you can make. Do I go to a program? What program do I go to? She knows more programs, I think, than perhaps anyone out there, second to none, I'll say that. And she helps families and people struggling navigate the labyrinth of treatment options available, but in a clinically informed way. And I think that unique combination of head and heart, that she's in this work because she cares, makes her a good reporter too. That we're not going to just hear a bunch of statistics. You're going to hear real useful information. So Amanda, we may have families listening that are wondering, how do we deal with the COVID crisis when we have a loved one who struggles with addiction? We may have therapists listening, outpatient therapists wondering, are treatment programs still open? We may have people watching who are wondering that work in programs, and people who concern themselves that struggle with substance, alcohol, and other issues. And if you just had one thing to say to them right now in the face of all this, what would that be?
Treatment's still happening. We can get you where you need to go. With a lot of practical and careful care given to you, your loved ones, to protect you from the vulnerabilities of COVID.
Programs are still open, or people, can you talk about that? Are they still out there?
Yes, they're still open. They are taking very rigorous steps to protect the new clients coming in. They're taking very rigorous steps to protect their staff and create the safest environment they can, and adhere to all of the recommendations of both on a federal level and on their state level and their community level. So they've been hardworking, actually.
Okay, so this is they have a heightened awareness. They're taking precautionary steps.
Oh, yes.
As families sort of weigh this decision about, do I send or support my loved one going to a program versus quarantine and isolating and socially distancing? Okay.
It's hard.
Yes.
It's hard work. They've been working around the clock trying to keep up on, what is the best practice? What are the recommendations? Their staff are, I would say, these are some of the unsung heroes right now in the world, taking some of the most emotionally and physically vulnerable cases and really being very deliberate in terms of protecting them. And they are working around the clock. So I've been really admiring of all of the staff and all of the administrators and owners of these programs who are working. I think I worry that they're not sleeping enough, honestly.
All right, you worry about them. I worry about them too. And I think you make a good point that they're frontline soldiers in this battle against addiction and co-occurring problems that come, anxiety and depression and shame and all these things, trauma, in the way that nurses are and doctors and orderlies and receptionists and stuff at the hospital, right? grocery store worker who's serving you food. We have these people that, and we don't hear about them in the news, right? So that's a wonderful reminder for all of us to send a thought and a prayer out to those folks, right? And it speaks to something about the dedication of the programs, I'm guessing. That
yes. Yeah, they are, I mean, they're trying to do, I had our friend Maddie, who we work with, you know, she was talking, so, you know, she was talking about some of the strategies that their program, you know, they're trying to figure out how to protect their staff and their population and putting in parameters and supports and housing and trying to do whatever they can to really protect their staff teams. We saw another one of our colleagues who's, you know, putting in hazard pay for these, you know, what we would call a nurse or an orderly in a hospital, are what we call direct care staff in treatment programs, or guides or mentors or case managers. And, you know, this program has put together, you know, hazard pay for them.
Right, these direct care staff you're talking about. So if you don't know about treatment programs, right, there's wilderness and residential and inpatient and sober living, and these are the staff that have direct physical contact with folks, so they can't do telehealth, and this program is actually giving them hazard pay. That's remarkable. So it sounds to me like this is important for families to know that it's okay and fine to ask programs if you're looking at a placement, you know, what protocols, what safety steps are you taking? And that programs are expecting you to ask those questions, I would guess. And if they're not, and they say, well, you know, we're not really doing much, or they are evasive or something, what would you recommend? To ask the tough questions?
Well, I would probably hang up the phone. Straight up.
Amanda's here. Amanda's here.
You wanted useful information, so let me just tell you, probably hang up the phone and call somebody else. But I mean, my team and I, you know, Ricky Becker and James Rowland, we've been for the last, I would say 2 weeks, maybe more, have been just in communication with programs. And programs have been in communication with us, telling us, what are they doing upon admissions? What are they doing if somebody gets sick? How are they protecting their campuses? Who's doing telehealth? Who's still directly on site? Are we doing family visits? I mean, we are tracking all of that information. That's what our team is doing at Integrative Approach. We are on the phone. We are getting daily updates. We're collaborating with other clinical consultants, really just trying to keep our finger on that pulse, because as we all know, this has been a rapidly evolving situation, day by day, state by state, county by county. And so we've had to keep our finger on that pulse, and the programs are doing a really good job of also communicating that to us as well in terms of what they're doing. And if they have a sick patient, client, staff member, you know, then they're letting us know that too.
I wonder if we could segue, because you said something that's so powerful. You said, you know, rapidly evolving situation. I know in my own practice here in Colorado, and you know, I work with people around the country too, and I just find so many people are calling and reaching out, both people in recovery, people that are wanting to see if they can go into recovery and their families, and everybody just seems like they're on this you know, heightened state of alert and angst, and that there was a little lull. I don't know if you noticed this, like right when it happened, it's sort of like everybody sort of hunkered down and sort of forgot about addiction for about a week. And now addiction doesn't know about COVID crisis.
No.
Well, right.
So I was talking to my friend who's a veterinarian, and I was like, how did this virus jump from this species to this species? And she's like, it's smart. It is smarter than us. And it is insidious. It's trying to survive. And when you know, and you and I have kind of talked about this, that's addiction.
Oh my gosh, yeah, right.
Right? Like
addiction's like a virus, right? And it can mutate. It'll go from alcohol to like cocaine to like
eating disorders, exercise disorders. Yeah. And
Mm,
so it's so like this virus is actually very similar to addiction. So
okay.
yeah,
So do
but
you
I
see
think
this
we're
like,
seeing ebbs and flows for sure. We saw pretty, 2.5 weeks ago, um, I was supposed to be on vacation, right? And so it was just the world stopped. And
mm,
at that point in time, we saw a big jump. When the schools shut down for adolescents and young adults, that's when we saw, not just in our practice at Integrative Approach, but other consulting practices and programs, we saw this huge skyrocket of
yeah,
let's get them into treatment now before they shut down travel, before they do this. And so that week was a really hard week for us. It was, some places were only taking people by cars. Some people were taking them as long as they didn't go through major international hubs. Some were taking them, it was just this really crazy, crazy 5 days.
so if we
Um,
sort of simplify this for a family that might be listening, or
mhm,
a person wondering about going to rehab, or a
mhm,
clinician, an outpatient clinician, that their
mhm,
client says, I think I really need to go somewhere like inpatient
yeah.
or residential. It sounds like folks out there are having to make these really important decisions about, is it worth it to me? I heard the program in Utah is really good. Should I get on an airplane, or should I go to a
Mhm,
program locally that maybe I don't know as much about? Does it matter where
mhm,
you go to? It sounds like there's a
mhm,
whole new layer of decision making that people have to
mhm,
make, and weighing like pros and
mhm.
cons of which
Right.
program to go to geographically. Would that be
Yes,
right?
yeah, absolutely. Geographically, but also we're layering in. Fortunately, this is something that I have already experienced. I've experienced H1N1, so that's and swine flu during treatment placements and that experience. But having a pandemic across the whole entire world, that's a new experience. But the other piece that people are also very, very cautious of that we have to pay attention to is the economics. And
Mm,
so there is a sense of what it felt like during the recession of how do we pay for treatment? What's going to happen if I can't pay for treatment?
no.
Are there insurance-based programs? Are there foundations? Are there, scholarships?
Mm,
And honestly, you talked about this in terms of the programs and staff. I mean, these are like the unsung heroes that are we're just like we're just in it to help people. And so I'm seeing a lot of programs help access to scholarships if they need it, trying to find ways for insurance. We're trying to find ways, maybe locally, just because there's a foundation. There's a lot of different ways that we're putting together that economic picture for people to help them manage more and more.
and what comes to mind is like, I would say to people, if you have the resources, don't ask for that scholarship because someone who needs it. But if you need it,
Absolutely.
ask.
Absolutely.
Ask, right?
Absolutely. Yeah.
Um, Anything else you see in terms of families and people's, struggling? Maybe they feel like the recovery's on the brink, or they relapsed. They relapse in the midst of
Yeah.
this. Um, I'm thinking about one of the things that comes to mind for me, um, and I said this to somebody just recently. I said, be careful about turning to alcohol right now in a crisis like this. Maybe you've kind of gone, on that sort of fine line between, do I have a problem with drinking, or I drink like
Mhm.
everyone else. This is where we can see people in crisis situations start turning to a substance, and get lost in it, and
Absolutely.
develop an addiction during a crisis like this, because it can be so soothing or distracting or lift your mood or something. Um,
Yeah.
so thoughts about
Yeah.
like dangers and opportunities in this for
Mhm.
people.
Well, I mean, there is, you and I have had this conversation, I don't know how many times. There's a naivete to alcohol,
Mm,
right? I mean, people don't realize that alcohol is one of the most, dangerous substances to become dependent upon. And it doesn't take much and it happens very quick. And so, that coming home, shut your computer, you're all working from home, the kids are crazy behind you. I just want to shut shut the computer down and just have a glass of wine. That's a scary habit to get started with. As we know, alcohol, that dependency, it doesn't take much to need another one and need another one. Like our body just does that naturally with alcohol. And,
And it's
and
available. They
and
kept all
it's so
the liquor
easy.
stores are open, right? Maybe I can't
Right.
get my Coke. It's harder to get hold of the person that put the liquor
Yeah.
stores there, or if I never
Yeah.
have done a
And we
substitute.
also have a really dangerous combination. I'm up here in Idaho, and you're in Colorado. So I've got Washington and Oregon right next to me that have, dispensaries, cannabis dispensaries. So then you have the combo, right? We
Mhm.
saw this when they started to legalize pot, is that, the combination of smoking pot and drinking alcohol,
Mm,
right? And then that's a very dangerous
right,
interaction, because we saw so many more alcohol poisonings when that started to happen, because the pot is suppressing the nausea feeling when you're drinking. And so you just drink more and
right,
more and more on top of it. And so then all of a sudden, here we are, we're flooding the ERs that don't need any more flooding with, alcohol poisoning, because we have that combo going on. So that's a concern, as well. But I think that we just have to be, I take this
well,
as a,
I'm not echo another concern you talked
yeah,
about and remind the other two is like if people through depression and just feeling so isolated and stuff, and you start, going, you decide to take a leap into something like you move from pain pills to heroin, folks
yeah,
need to know that out there on the streets that the heroin is way more dangerous and it's so much more
yes,
likely to have fentanyl in it. And if you shoot up with something that has fentanyl, the time that your
mhm,
friend has to get the ambulance to you is shortened dramatically, and they may be too busy to come get you, and
right,
so it just sounds like a heightened awareness that
hmm,
I think I would summarize it as perhaps there was a little pause as we all tended to this,
yeah,
and addiction didn't go away. And
nope,
addiction
still there,
could ride COVID's back into your life
yes,
or exacerbate with
yes,
COVID, using COVID to kind of, when we're physically isolated, we feel depressed. Why not drink to excess?
yeah.
Um, the kids are
Well, and
overwhelming us,
the
whatever that
kids
is,
are
right?
overwhelming us, and this is what, and you and I have talked about this, I know, recently. There's an upside
Yeah,
to being sheltering in place,
right.
right? There is an upside, and I've spoken to a few of my clients and families, um, and I shared that really awesome video that one of my young adults said, created for us,
Yes.
where he said, I get to be at home with my family. I'm playing catch with my dad. I haven't done that since I was, 5 years old. Or I get to go for hikes in the woods with my mom, or I get to play with my little sister or my big brother, whatever it might be, right? There is an upside to the simplicity.
Right. I think so. And I think even in this theme
You,
around
yeah.
addiction, I'm noticing the calls I'm getting. There's a qualitative difference between a call
Mhm.
that I'm getting now and a call 3 months ago. And there's a
Mhm.
certain rawness between, a partner and the partner of concern or family members and stuff. There's a vulnerability I'm hearing from everybody involved that
Mhm.
somehow what COVID also does is it sort of strips us of, we're also overwhelmed, and
Yeah.
our executive functioning is maxed out by this wondering every day. We're all sort of stalking the crisis and wondering what's
Yeah.
next, and how's it going to
Yes.
impact us. And then our hearts come out,
Mhm.
deeper opportunity of our hearts, and this opportunity to slow down and maybe as a culture to ask ourselves some big questions, right? That you and I have talked about this a lot, and in the work we do with programs, how come alcoholism rates are rising over the last 10, 15 years? If this is just a biologically, driven thing, the rates should stay flat, but they're
Right.
going up. Why do we
Right.
have so many more deaths? Why did the opioid crisis take place? Why are people out there, crack and meth and drinking to excess and turning to pot? Hey,
Yeah.
I'm all for legalized pot. Why waste money, you know,
Right.
arresting people, use the money for tax it, et cetera. But let's be honest, if we start turning as a culture to pot as our release and getting high every day in order to deal with life, we're not looking at something. So maybe there's an opportunity for us to take a breath as a culture and ask about our relationships, our connection, like you said, the opportunity. Maybe I put down the glass of wine, or I don't have the second glass of wine, and I go pay attention to my kid.
Or I don't work.
Don't worry, I actually just stop.
Right?
Yeah.
Right? I mean, like, that's the other part of it is, you know, addiction, and as you and I talk about this all the time with addiction is, you know, thought of as a substance, but it's actually an avoidance strategy.
Right.
It's a soothing strategy for something that we're missing, right? Or that's not satisfying, or that's harmful. And so that's this piece where what I would say is, you know, work is just as addictive and is just a wonderful excuse to not be at home, or to not connect with my kid, or connect with my spouse, or my stress is so high, just let me binge my Netflix, you know, whatever it might be. And I think that, you know, economically, yes, there is going to be a really big impact here. But I know that as a country, we're good at responding to those moments. I think I've learned that. I trust in that, in my common citizen to step up where need be economically. But the piece of this is that, like, we so avoid connection and find excuses, and we have an opportunity here.
That's right.
To slow down, reevaluate our lifestyles, take a look at them, spend some time with our kids, spend some time with our spouses, right? And these,
and
like,
ourselves.
I know, and ourselves,
our higher power,
ourselves.
our faith, our values,
Yeah.
something that was with us. As I woke up this morning with this sort of my voice in my head saying, reflect, Jim, on that was with you before this, is still here now, and will be with you afterwards, right? Remember the course of time. And I think what you're saying is so important, that and like, I know what you mean by the economics, and look, we both know there's people who've lost their jobs, and they're laid off.
Yes.
They're wondering about keeping their apartment. And we do have a tendency as a culture, you know, that a percentages of us will ride this out in a different way than another group. And maybe this thing, addiction and COVID have in common is they don't care about your economic status. They don't care about your gender identity, your relational orientation, your faith, your age, your ethnicity, you know, your skin color. Both addiction and COVID just see us, we're just cellular beings, and they're sneaky and pernicious. You know, that COVID sits on a surface for a while, the bottle sits in the cupboard whispering. And they have a different destructive tendency, right? And we can die from COVID, and that's,
well, we can die from addiction.
And we can die from addiction, right? Addiction can kill. I like what you're saying, and I think maybe what you're starting to get at is what we're doing together. Maybe, you know, what you could talk about bringing an awareness of the importance of these emotional bonds and our attachments, and the bonds that tie families together, that we often sort of label as like codependent or something. Because you're speaking to that, I think. And the other, before I forget, when you were talking about there's sorrow in this.
Oh yeah.
And we as a culture don't do very well with sorrow, do we? We want to. I woke up this morning, it hit me for the first time. I think I've been busy. I'm trying to resource and respond to clients, and be there for my wife, and be there for my adult children, and be there for everyone else. And saying to everybody, there's a lot of grief in this. And then I got smacked by it, man. And I just ended up, my wife came towards me, and what's going on, and she could tell, and I just started sobbing and thinking, who's out there afraid that somebody could die from this, and who's alone now, and even more alone, and at risk for addiction, for our topic. But just so what this thing and addiction and COVID and its impact on relationships. Talk about emotional bonds and what you're referring to.
Well, you know, I guess I'm sad because I've been so busy that I haven't really had a chance to slow down the way that I was hoping to on vacation, but also just like in, how other people are experiencing the COVID crisis. I don't have a slowdown, right? You and I aren't slowing down. People need us more than ever right now to navigate this emotionally, because we are their safe person, maybe. And for an individual therapist, we might be that safe person for them, or a couple that might have been really struggling, who might have been coming to see you for an immersion, is like, how am I supposed to get to you? Like there's a lot of people who are hurting right now. So you and I haven't really had a chance to slow down and enjoy, but I do recognize, even for myself, my family, like the very first week of all of this, I was FaceTiming with my mom and my sisters and my dad, like every morning, right? Hey, how are we doing? What's going on? What's the plan? How's everybody holding up? Oh gosh, your school closed. Oh gosh, you're still going to work. Oh gosh, like kind of like catching up with everybody. And I have some friends who, some college friends who said, who reached out to me and said, hey, can we meet on Thursday and let's do a video FaceTime? And so now every Thursday we have this wonderful like FaceTime, like, coffee moment. And then I have, I got a message this morning from my sister who's like, hey, the cousins are going to get together on FaceTime tonight at this time. And it's like, okay, like we're figuring this out, right?
Yes, we are.
I felt really bad the other day. My parents lost a friend. My parents are in their mid 70s, and they lost a friend, not to COVID, but for other reasons, from other issues. And I felt so sad for them because these are like, there's no funeral. They can't travel. They can't go.
They can't go be with them. They can't
Yeah, and
gather
so that
together
was,
in community and mourn them and celebrate them. And
yeah.
this
So
is,
I just like got on FaceTime. I was like, I FaceTime everybody, and it's like we all showed up. Both my sisters, my mom, my dad, and we were able to be there for my mom and dad, throughout that moment of learning about the loss of one of their dearest friends. So there's ways that I feel like we're showing up, and fortunately, Jim, you and I, in our trainings, like, right, we talk about this of, trauma, right? People who have trauma might not be able to see those moments right now. They might not be able to see those moments because they're so scared, right? And they're stuck, and they're only seeing the threats, right? And so, and the fear. And that's true. That's true for people right now. We have to really recognize that.
right. And if you're struggling with addiction,
yeah,
this is just another external stressor. Or, John Bradshaw back in the day would say, another reason to drink.
Right, exactly.
Drinking because of COVID, sheltering in place. Oh, they said we could go back out and hang out together. I'm going to drink to celebrate.
Yes.
But it becomes just another stressor on us, on our trauma, or
yes,
triggers our and it challenges our hearts and how how much do we feel like we belong in the world and have a place to lean into. You just gave a lovely accounting of all these people you can turn to. And I think for families that are struggling and have a person at risk, or a person who uses, or maybe been in denial, or a person in a program or something, now is maybe more than ever a time to shower them with love, because you've got the time to do it. And they are probably more struggling and isolated than you imagine. Yes. And you and I share, and maybe we can kind of close with this, is the work we've been doing that's so important, and why I wanted to hear from you about what's going on in the programs out there and in the field is bringing this knowledge that Jonathan Hari says, that the opposite of addiction isn't sobriety, it's human connection. And
Yes.
that we are attachment beings, that we
Yes.
bond with each other, we emotionally bond with each other, and we emotionally
Mhm.
depend on each other. And as Sue Johnson in Love Sense says on page 17, emotional dependence is neither a weakness nor immature. It's our greatest
Yes.
strength. Our
Yes.
emotional dependence on each other is what is making us empty the streets, right?
Yes.
Emptying the streets
Exactly.
is an act of love and
Yes.
care and community care. And
Yeah.
I think that these emotional bonds are both being stressed and they could be being strengthened through this. But if
Mhm.
you're out there listening to this because you're a therapist working with this, a program working with this, a family working with this, the pain you're feeling, the sorrow you're feeling, the fears, the hopes are all in an emotional world
Mhm.
normal, and they tell us something about how we matter to each other.
Exactly. Well, and I think about our, yesterday, on our call.
Well, wait to say what our
Um,
call is. So
oh,
tell them a
okay.
little
So
bit
what our call
about
is,
that
so
real
our,
quick. Give
our
them
call.
context.
So, well, I mean, how wonderful is that? We did this beautiful Zoom call with, how many people did we have on that phone
9 or
call?
10
9 or 10
different programs.
different amazing programs, clinical directors, therapists, owners. Jim and I did this wonderful training. We've been working with this cohort for almost 18 months now, of these leaders in
So let me tell you what
addiction.
Amanda's talking about. She's so excited. She's leaving out the
I'm so
details. Let me
excited,
just
I
say,
can't even talk about it.
about 5 years ago, Amanda said to me, we need to bring attachment theory and emotionally focused
Yes.
therapy, which is a therapy model based on attachment theory, that values human relationship, values emotional
Yes.
bonds. I quoted Sue Johnson. She's the main developer of the model. And we need to get this into the attachment world. And you said to me something, I forget
To the
why you
treatment
said it
world.
was,
I told
why
you that we have to get
me?
this into the
Why
treatment
did you,
world.
how did you talk me into it? You told me I was
I
the
don't know.
only one
Oh,
who could have
oh,
that.
that's right. Yeah. So I said, you're the only one who's going to be able to help these treatment programs who are dealing with addiction and recovery understand emotional focused therapy and the value of moving back towards the family and helping the whole family recover, because for a multitude of reasons, but mostly is that you have your own recovery story, right? You and Patrice, you and your wife are what, 32 years sober, almost
Last July
33.
7th on the same day.
Yes.
Yeah.
Yes.
Mhm.
So you guys have a recovery story together. And the treatment world really values that in terms of not just being somebody who studies it, but somebody who's experienced it. And then your approach with teaching adults, because teaching adults is really hard. We're not an easy population to teach. And then the third part
Experiential
is,
learning, because so much
it's well, that's just
addiction
it.
is,
That's the
yeah,
third part, is that you're an experiential teacher.
yeah.
So you're going to be able to reach into these professionals, into their soul, and really attune with them, and understand what they're going through, and also your professional experience of running treatment programs and residential. And
Yeah,
so you kind
actually,
of were like the
want to
whole
read, you didn't
package.
say I was the only person. You said, well, you did say it was a unique combination.
Yes.
And so you and I have gone into that world now. We started
Yes.
about 5 years ago. We started doing the 4-day trainings a couple of years ago.
Yeah.
And the people we were meeting with are programs. So if you're interested, there are programs out there, and you can
Yes.
contact Amanda or I, that are weaving this valuing of emotional bonds and the attachments you feel with each other. And what I say to the programs is, we have family realities. The reality of emotional bonds you have, if you're watching this, for that person you love, or if you're out there watching this and I want to stop being in this craziness. I want to stop drinking or shooting up or smoking or snorting or popping the pills. And you're one of and it's like, I want to do it because I love my family. I want to do it because I love my kids. I want to do it. I want to do it for my partner, my wife, or my husband. I want to do it for my mom, my dad, my son, my daughter, my dog. Attachment-based programs, we don't care why you quit. That's a good reason to quit. You don't have to just be quitting for yourself. You can quit because you care about other people, and you can approach someone you care about to intervene from a loving place. And we can help you with that too. We can
Mm-hmm.
intervene from an attachment base and help wake up people's hearts and find the wounded hearts out there. There are programs that are attachment friendly and attachment based. So that's the passion that brought us together. And I think what we saw yesterday was how much those programs are willing to carry family and people struggling with addiction, their pain, and have hope for them.
Mm-hmm. Well, and I think that, you know, the team that we were working with yesterday, or the cohort that we were working with yesterday, I think what they have is, you know, this dedication, you know, to the bonds that heal.
Yeah, that came out throughout the whole
conversation of, you know, how they are seeing the bonds impacted, not just right now, but how bonds might be affected over time within families. And that, you know, just sharing from that place of, you know, sorrow, but also I heard a lot of gratefulness in them as well, of how appreciative they are to have an attachment model of treatment that they've dedicated themselves to, and that they've done the rigorous training to be able to deliver it across their program, that they are so grateful because they're able to understand a loved one's anxiety when they pick up the phone, even if it's a COVID crisis, right? And they're picking up that phone, a parent's picking up that phone, or a spouse is picking up that phone and saying, I have a loved one. What do you got going on? What are you doing? Do you have a COVID? Do you have an isolation room? Do you have this? Do you have that? And you know, all of those wonderful clinicians on that call yesterday were able to say, it's a really scary time out there.
That's right.
And they were able to really, you know, together collectively slow down and see all of the aspects of concern and worry that COVID has brought to someone, but still remembering that addiction is alive, that trauma is still happening in people's lives, and that how can they show up with their clients and with their family members and their loved ones and help them make sense of this in a way that can help them rejoin as a family.
The values, their bond with each other, values that they care about each other, can help them learn to set boundaries and things as necessary, but not have people going in separate ways in recovery, but programs that'll help bring you back together to find each other. And it's a good wraparound. You know, you started by talking about a family and calling, and our program's still out there. And I think what you said about it's scary. If you're listening, it's scary times. And maybe we can be scared together. Maybe when you make that call, or you call your loved one, or you call your family to say, I think I need to go to treatment. Maybe just, you can say to each other, hey, we're scared. And we can hold hands with each other metaphorically until it gets safe to hold hands again. I think what I heard you say too, if I were to summarize it, the addiction and the struggle is not going to go away, that it's intensified by this. But I also heard you say that it creates opportunities, that we both believe it creates opportunities, it opens people up. You said the programs are still out there and admitting clients.
They are. Safely.
Yes. Though with the one exception is I'm hearing a lot of intensive outpatient programs are closing down or just doing telehealth. So it's an interesting thing, but we don't want to surprise you if you call an intention, you know, wait, Amanda said all that. We're talking residential, wilderness, inpatient. That there really are big impacts on these changes on people. It's resulting in decisions about, like, should we send somebody on an airplane somewhere? Cost are a big concern. You were concerned about the staff and how the staff are dealing with this, and we wanted to send love and support to them.
Absolutely.
You know, maybe if you're somebody in recovery, and a program really helped you, you know, it's 10 years down the road, and maybe you call a place like Ascend in Utah and say, I'd like to buy pizza for the staff. Just
Yeah.
something to say, I know
Yeah.
what you guys are doing.
Yeah.
And we talked about that this is impacting all of our emotional bonds, and that we have strong feelings about what's happening, and we're supposed to.
Yeah.
This is a big time.
I think it's a calling. It's
Yeah.
an opportunity for us to, we've talked about being a disconnected society, and yet I'm seeing the opposite,
Yeah.
right? Right?
Well,
It's
maybe that's
like,
a second video. Maybe if
yeah,
we'll post this, and if people are interested, we
no,
could have a second conversation about what you just said about
no.
the opportunity in this, and how it's, I like you always say to me, where is homeostasis being disrupted, and where ought homeostasis be maintained, right?
Mm-hmm.
Um,
Yeah.
what are the larger...
That's too geeky for this one. We'll say that for
Yeah,
a
that's too
different
geeky for this one. Let's do a
day.
geeky one. We're all fans of the Big Bang Theory. We'll be back with Jim Parsons as our guest. Sheldon reacts to the COVID crisis, coming to you at 11. Well, let's give a big, we love all of you. Thank
Yes.
you.
Oh
And
my
we'll
gosh. Thank you
see you on the other
so
side.
much. Thank you so much to all of the transport people, the interventionists, the sober companions. God, you are, man, you guys have a whole new level of worry and work right now. So thank you, the clinicians, the direct care staff, the people transporting, all of you. Like, this is,
Well, thank you, Amanda.
you are
So look,
putting yourself at risk.
let's do this real quick. If you want to get hold of Amanda, it's give them the website real quick.
integrativeapproachtx.com.
Integrative Approach, tx.com. I'm Jim Thomas. I'm at jimthomas.care. And I specialize in 2 and 3 day intensives or immersions with couples, families, and individuals.
And you're still doing them
Colorado.
online?
And I'm doing them via Zoom. And after you can come see me here in Colorado. It's my passion, and I'm a big fan of emotionally focused therapy. And if you just want a relationship book for getting through this time, I highly recommend Love Sense by Sue Johnson, one of my favorite people on the planet. It's called Love Sense, like SENSE, that love makes sense, by Sue Johnson. It just, if you were intrigued by the ideas around our emotional bonds matter, we're supposed to emotionally depend on each other, and those things, that's a great book for lay people or a clinician that just wants a non-textbook introduction.
Right.
And it's just a book about relationships, not addiction in particular. So we're going to sign off. And if you we welcome your feedback wherever you find this video or on YouTube. And if you're interested, we'll do part 2. Thanks, Amanda. It's a pleasure.
Thanks, Jim.